This is for those who, when times got rough, showed that they were made of tougher stuff. When they decided we would not be defeated, may they forever know their actions were needed. It was because they answered the call, standing tall, they prevented our fall. They may be the faces no one knows, but they're our time's unsung heroes. Because it wasn't an effort of just a few, tiny acts of love are what guided us through. One day our sons and daughters will ask how we crossed these turbulent waters. We'll say it was thanks to those who bothered. They were the best of us who carried the rest of us forward.
Good morning, everyone, and thank you for joining us today for the board meeting of July 23rd, 2020. I'd like to ask the board corporate secretary, Ms. Ellison, to call the roll and then let us know who from staff is also joining us this morning. Ms. Ellison.
Chair Smedberg.
Aye.
Vice Chair Gideby.
Present.
Vice Chair Goldman.
Present.
Director Horner.
Present.
Director Letourneau.
Present.
Alternate Director Meridian.
Present.
Director Slater.
Present.
Director McMillan.
Here.
Also, Mr. Chairman, you have a quorum. Also participating on today's call is General Manager and CEO Paul Wiedefeld, the following Executive Vice Presidents: Chief Safety Officer Teresa Impastato, Capital Program Delivery Laura Mason, Strategy Planning and Program Management Tom Webster, Chief Operating Officer Joe Leader, Chief Financial Officer Dennis Anasike, and Senior Vice President of Customer Service Communications and Marketing Lynn Bowersox. Thank you.
Thank you, Ms. Ellison. Now we have an agenda before us for approval. I'd like to move the agenda with one change: the removal of consent item A, indemnification of ISO claims indexing service. Staff will come back in September with this item. Is there a second?
It's a second from Mr. Goldman.
Thank you, Mr. Goldman. Okay, we have a motion and a second. All those in favor?
Aye.
Any opposed? All right, the agenda is approved as amended. Now we move on to the next item, approval of the minutes. We have 6 set of minutes for approval: the June 11th board meeting, the June 23rd special board meeting, the June 11th executive session, the June 16th executive session, the June 23rd executive session, and the July 9th executive session. I'd like to move approval of these minutes as presented. Is there a second?
Second.
Seconded by Ms. Gibbity. Any questions or comments on any sets of those minutes? If there are none, all those in favor?
Aye.
Aye.
Any opposed? The ayes have it. Thank you. Next, we will move on to the employee spotlight, and I will turn the floor over to the general manager for this presentation. Mr. Wiedefeld.
Good morning, Mr. Chairman and the rest
Morning.
of the committee. Today, we're recognizing Dr. Amy S.B. Smith, who's worked tirelessly around the clock since February as we have dealt with this unprecedented public health crisis. As a major leader on the pandemic task force, Dr. Amy has helped Metro develop and implement all appropriate measures to protect the health and safety of our frontline colleagues, customers, and the community at large. Under Dr. Amy's leadership, Metro's small occupational health and wellness team transformed overnight from a standard return to work staff into a public health team combating unknown viruses. And Dr. Amy's here on the screen with us now. In a short matter of time, Dr. Amy created systems and processes helping guide Metro through this ongoing pandemic. She and her team quickly established a self-reporting portal for employees and developed transparent, public-facing data reporting page on WMATA.com. Since the pandemic began, Dr. Amy and her small team have monitored, tracked, and consulted over 1,000 employees who have been directed to self-quarantine by their personal physicians. This includes the 210 employees who have tested positive for the coronavirus, along with scores of others that have been directed to self-quarantine after possible interactions with coworkers, family members, and others that may have had the virus. In addition to her work behind the scenes, Dr. Amy has also served as a wealth of information for employees during our Metro Voices videocasts throughout the pandemic. With 210 confirmed employee cases as of July 15th, nearly 200 have returned to work, and there have been no fatalities. There is no doubt that her actions have saved lives. So thank you, Dr. Amy. And on a personal note, amid everything going on this year, Dr. Amy has also continued her full-time job as a mother of a teenager, who begins her virtual coursework this fall at her own alma mater, Spelman College in Atlanta. So congratulations, Dr. Amy, on that. So now please join me in saluting Dr. Amy for her leadership to this point, as well as her future work as we continue to fight this public health battles. And Dr. Amy, do you want to have any comments?
Yes, thank you so much. I just wanted to say, I'm deeply honored and humbled to receive this recognition. I've been grateful and fortunate to work for an organization that cares deeply about the health and safety of its employees. And it's allowed me the opportunity to work in my life's passion to ensure that we're able to take care of our workforce. And I've been able to meet some amazing people along the way. The pandemic has actually afforded me the opportunity to develop deeper relationships with many employees that I otherwise would not have had the opportunity to. And I think that will help me be more effective in the future at my job with these relationships that I've developed. I do want to thank the general manager and the board for their trust and confidence in me as chief medical officer. All the members of the pandemic task force and the ERT who I've had the honor to work alongside as we've all tried to tackle this pandemic with diligence and devotion. The EMT and all of their members, and as well as our IBOC team that have all been supportive of us in our endeavors to fight the pandemic. And lastly, just want to say this honor would not be possible without the dedicated staff and team I have at Occupational Health and Wellness. They have worked tirelessly and diligently as well to ensure that we're able to provide high quality care for our patients while maintaining the confidence of all the patients that we have the privilege to serve. So I just want to say again that for all of you and with all of you, I accept this recognition and I thank you all for your continued support.
Thank you, Doctor.
Mr. Wiedefeld, anything else you'd like to say? Or?
No, sir. I just, again, congratulations to Dr. Amy. And I just can't thank her enough. I mean, she has been working around the clock for months now. And she's the person I call at all hours of the day just to find out what's going on. So I appreciate everything she's doing. And congratulations again on your daughter.
Thank you so much.
And Dr. S.B. Smith, I'd like to say on behalf of the board, and I feel confident I can do this, to say, you know, how much we appreciate your work and also the work of your team, really. As you mentioned, it really is a team effort, as you know, and when it comes to health related matters and initiating them. And so really applaud you for all you've done in a challenging time and what will be continuing to be a challenging time in the coming months. Right. As we ramp up service and hopefully get the region back to normal within, you know, the next 5-6 months or so. All right, thank you. Really appreciate it.
Mr. Chair, I'd like to offer my own offer of appreciation. Dr. Amy Smith, I'm really grateful. It's clear you were called for such a time as this. There was no way that we could have planned or foreseen the pandemic. But I think from January, when the emergency response team was pulled together to really start to monitor, I felt like it really spoke to the early interactions that ensured that the region would be safe. And it was through your leadership and, of course, Teresa Ambasada as well, the Chief Safety Officer, that helped to guide us. And as board members in trying to monitor and understand what was happening, I truly recall the February meeting where you all briefed us and was putting into place what would happen if we had to shut down the system. And it was something that I could not have foreseen in February, and it became our reality by March, when we first had our first incident in the region. And I think the reason that we've been able to be as cautiously safe and ensuring that our employees have been as healthy and being able to return back to work is in part because of your leadership. So I too just want to echo my appreciation for your leadership, for your vision, and for your commitment coming in, and for all of our employees who continue to serve as essential workers to ensure that we can get to where we need to go to safely. Thank you.
Thank you so much.
All right. Thank you again, Dr. S.B. Smith. Really appreciate it. And now we'll move on to the public comment portion of our agenda, which we are doing a little differently this time.
Good morning, Mr. Chairman. There are 4 public comments today. Here's the first, Teresa Mara. I already left a public comment, but I was hoping to contact the board. Because of COVID-19, these drivers take an hour before coming to your location. People have to sit out in the sun for more than an hour just to ride the bus, and if they are late to catch the bus, these drivers have no empathy to just hold up for a few minutes just so that person doesn't have to wait another one to ride. There was this one time the bus did not show up for an hour 30 minutes, and when it came, there was a gentleman trying to catch the bus, and he tried to stop the driver, but he just drove off. And when we told him to stop, he said, "I don't want to know," and ignored everybody. And today, the 74 to Shady Grove left at his own time, which means I have to wait an hour at least, just because he decided not to wait when he saw me walking toward the bus. Our second public comment is from Jim Land of Arlington, Virginia. Please close Metro by 7:30 p.m. on July 4th. I'm sure that the crowds will be down from previous years, but they won't be down enough to keep your trains from becoming super spreader events. Even if you enforce no crowding on the trains and no crowding on the platforms, the areas outside the stations will be packed. It is much, much safer for people to park a mile or 2 away and walk to their cars. People spread out when they walk. Fewer people will attend if they know they can't take Metro home. So what? Yes, I have depended on Metro to get home from fireworks. Public comment number 3, from Niels Pemberton. Should DC United and Washington Nationals resume play at their stadiums with spectators in fall 2020, I must have some form of Silver Line service running up to midnight, or I can't work. This is non-negotiable to me. I hope the leaders of WMATA are cognizant of this fact. I am one of many people who do not work traditional hours. I want WMATA's leaders to realize this. I would be happy with Silver Line Metro service running at a 60-minute headway after 9 p.m. or special replacement bus service, but I must have a way to go home by public transit after work. And finally, public comment number 4, from Eli Creverio Frankel. My name is Eli Creverio Frankel, and I live in Washington, D.C. Today I'm thinking about how I miss my pre-pandemic commute on Metro. One thing I can say I do not miss is the presence of Metro Transit Police Department throughout the system, targeting certain riders and upholding the same problematic structural issues as other police in this country. As a Metro rider, I have witnessed Metro Transit PD target black riders, especially young black riders, and treat them with suspicion. Beyond my personal observations, I have read about events such as a June 2019 incident where a Metro Transit police officer used excessive force on a black Metro rider. I call on the WMATA Board to question the need for police force presence on our transit system and to ask for funds to be reallocated from Metro Transit PD to elsewhere in the budget. I believe our system and its riders will be better kept safe by funding social workers to address issues with public health approaches, protecting riders, and not basing their role with violence or force. These funds could go toward improving our system and adding capacity to increase transit. The District of Columbia has the highest police to civilian ratio of any state or territory. Adding Metro Transit police officers does not make us safer, but creates an aura of fear and unsafety for riders, making them feel targeted or watched. Let's make Metro, our buses, and our transit system overall better and safer by diverting funds from Metro Transit Police Department to nonviolent public health initiatives to address structural problems in our regional transit and support our community. Focus transit on helping people get around and supporting them in their lives rather than targeting them and creating a system of fear. Thank you. That concludes our public comments for today.
Good morning. Welcome to the 30th anniversary of the ADA being enacted. In commemoration of this month's 30th anniversary of the Americans with Disability Act, the Accessibility Advisory Committee to the Washington Metropolitan Area Transit Authority enthusiastically passed a motion recommending that the WMATA Board consider developing a public placard similar to the current Title VI Civil Rights public placard. We request that the new placard be posted next to the current Title VI Civil Rights placard, which is already on display at every kiosk in the Metro Rail system. The AAC is aware that the ADA sets the minimum federal standards, and we are grateful that WMATA often exceeds the required minimum. This fact might be included in the new placard. It's been an exciting summer for us so far. We started to use Zoom for our AAC meeting and all of our subcommittee meetings, and we've had a huge increase in public participation. We'd like to compliment the board for doing similar things with their YouTube presentations and their Zoom recordings. Actually, last month, the RAC began to do their virtual meetings, and we found that AAC members are attending to the RAC meetings and participating in the discussion, as RAC has also participated in ours. So these new virtual meetings appear to be very, very useful. During our meetings for this month, we talked about PPE and the safety of bus, rail, and metro access for employees, the drivers, as well as for the passengers, and we think that WMATA is doing a great job in handling this, and also complimenting the staff, employees, and the riders for working together to minimize risk. We discussed the new design for the Metro Access vehicles that will be ordered for the coming year, and we put together a list of things that might be very useful for us and for the system. And ADAP is moving forward with this and developing an RFP for purchase. We will be following this procedure enthusiastically. We also had an update on the elevator escalator updates that are currently going on during the summer renovations. And it's an opportunity for us to standardize the buttons that are on the current elevators. As you know, we've talked to you on several occasions about the difficulty in non-standardization in buttons for people with low vision in accessing the elevators. We also had a good discussion on the new fare gates and talked about their accessibility, and also how they can be made better available during potential outages, particularly in the accessible fare gates that might go down, and now the station manager might be able to open them up for people in wheelchairs or disability devices or people with baby carriages or luggage. We also have kept updates on the summer shutdown and the bus shuttle, and WMATA is doing a great job. As Mr. Wiedefeld has reported on a number of occasions, you're way ahead of schedule, and hopefully in the fall and spring, when the system goes back to full operation, because the pandemic is under control, things will be working just perfectly. At this time, as an annual practice, the AAC would wish you a safe summer break for the Board of Directors, even though we know that you're going to be working over the summer without your August meeting, and we look forward to seeing you in September. Thank you very much, and happy to answer any questions.
Members of the board, it's my privilege and pleasure to join you all today, if not exactly live. We're grateful. I'm grateful for the chance to be able to record this and present this to you all. I do, of course, also want to take a moment to thank our staff member in the board secretary's office for his extraordinary work over the past couple months in keeping us moving, despite all of the challenges that recent events have presented us with. So I do want to thank him on behalf of myself, of course, and all of my colleagues. As you all have read in our report, we do have continued concerns about social distancing on Metrobus at the present time, and also as Metrobus scales up in August. As you all know from WMATA's pandemic response plan, current capacity for Metrobus is daily exceeded, as specified in the plan, of about 80,000, I believe. And then, of course, on August 16th, that will be going up to 110,000. That said, as you all may have taken note on WMATA's pandemic response page, current bus ridership is generally somewhere in the range of 120 to 140,000 daily riders. This does create, of course, social distancing concerns, not just at the peak periods in the afternoon, as Mr. Hamry pointed out at our previous meeting, but also during the morning or whenever folks might be heading into work. We're thinking especially here of the essential workers, the nurses, the doctors, the other hospital workers who really might not have any other choice, to say nothing of the people who work at grocery stores who have played such a central role over the last couple of months. We would also like to take note of the fact that other transit agencies that use similar technology from the same vendor for ridership counting, such as Pittsburgh, for example, are taking the data that they can get from their onboard bus counters and streaming that data to the app that Pittsburgh has, of course, but also making it available on their website. We hope that WMATA staff are currently investigating the possibility of extending this to the DC region, and we hope that they are successful. I have no doubts that the popular transit apps like Transit or City Mapper might also be interested in taking this data on. This can be, of course, a powerful way to encourage social distancing and help riders make the best choice in this difficult time. I do want to take a moment to thank our new members who will be joining us in the coming days at our next meeting in September. We do look forward to having them join us to replace some of the folks who we have unfortunately seen term out or otherwise leave the RAC for whatever reason. So we do look forward to welcoming them. We also look forward to the appointment of a new board liaison. As you all know, our previous liaison left the WMATA board a couple of months ago, and we do hope that someone might be able to join us in the future. Of course, Mr. Smedberg, you will recall that back in September of last year, you were our distinguished guest, and we would love to have you back in the coming months. The same goes for you, Mr. Wiedefeld. You did join us last year, and we'd really appreciate having you back, especially once all of these new members come on, and to have them have the opportunity to get to know you all and kind of build that cooperative relationship that all of us on the RAC hope to have with all of you. Finally, as we move forward in the coming year, I do want to express our hopes that we can have some kind of briefing on the planned customer service improvements, and also as the mobile pay app, WMATA's app, which I understand is currently in a very early testing phase, we would be happy to contribute to that in any way we can. As always, the RAC looks forward to a cooperative and productive relationship moving forward. We are grateful for the opportunities we do have to sit down with WMATA staff. We're also more than happy to speak with civic associations, neighborhood groups, regional groups, of course, provide commentary to groups like the NVTC or DC Suburban Transit Commission, or just anyone who would be interested in starting a dialogue about transit issues in the region, especially at this difficult time. All of my colleagues, of course, are happy to speak to the groups in their respective areas, and I look forward to doing that in a few upcoming civic association meetings here in Arlington. So I want to thank you all again for the chance to speak to you all today virtually. I look forward to hearing from you all. I can, of course, be contacted through the board secretary's office if you all have any questions or concerns. And please stay safe and healthy and well. Thank you all very much.
Thank you, Mr. Posner and Mr. Carrig, for your reports. I appreciate that very much. Next, we'll move on. We'll be hearing from the General Manager, Mr. Wiedefeld, who will begin our update on Metro issues related to the pandemic and recovery plan. Paul?
Thank you, Mr. Chairman. I want to start with an update on our efforts to keep customers and employees safe through the pandemic recovery plan. In a moment, the board will be briefed in greater detail about our preparations to move into the what we call the managed re-entry phase 2 of the plan. It's an important step in this phase is to increase service on Metro Rail and Metrobus that will keep capacity ahead of demand and may allow customers to maintain some social distancing while in the system. So starting on August 16th, we will increase rail service to about 90% of pre-COVID levels, nearly doubling Metro Rail capacity as a result. Metro Rail will also add 15 hours of service per week, with opening times returning to normal and system closing at 11 p.m. A week later, on August 23rd, Metro Bus will restore approximately 75% of the pre-pandemic service, with weekday service on 175 routes improving to near normal service levels. Buses will also operate an additional hour until midnight. Thanks to the CARE Act, we're able to increase the service to improve the safety of our customers and support the region's economy. However, there's so many uncertainties, as we all know, about what will happen with riders returning, to what level, and the jurisdictional revenues and the pressure they're under, that we cannot sustain this level indefinitely without additional federal funding. So I know that that bill is working its way now through Congress, and we hope that is presented to us fairly shortly. Another step in phase 2 of the recovery plan will be the distribution of 500,000 face masks to our customers. These masks were donated to us by the Federal Transit Administration and will be available in the system free of charge. While most riders have embraced the use of cloth face coverings or masks, providing these free masks will help those who may not have the means to acquire them or simply just forgot them at home in the first place. Our enhanced cleaning protocols will continue, with stations, rail cars, and buses disinfected on a daily basis. That includes mopping, wiping down surfaces, and using electrostatic foggers for disinfection, with particularly focus on high-touch areas. And we continue to evaluate new cleaning techniques and technologies. In fact, we're piloting a UV disinfection product, which is designed to continuously disinfect escalator handrails, allowing our cleaning crews to focus their efforts on other high-touch areas. Also, before turning into the more detailed presentation on this from our team, I did want to give an update on the platform improvement project. As a reminder, we will also restore service. We will restore service on the Silver Line and reopen 6 Fairfax County stations on August 16th, weeks earlier than originally planned. The new reopening date reflects the progress made on 2 fronts. First, the platform reconstruction crews have had a productive summer so far, and trains will be able to pass through East Falls Church Station beginning on August 16th, although the station will remain closed to customers due to ongoing construction. Second, the Silver Line Phase 2 work that required a temporary suspension of service will be completed by the Metropolitan Airports Authority. The 3 stations west of Boston that remain closed for the platform construction, meaning Vienna, Dunloring, and East Falls Church, are scheduled to reopen on Labor Day. And on the financial front, before I turn it over to Tom and his team, I'd like to share some positive news on that front. Earlier this month, the Government Financial Officers Association awarded Metro its Certificate of Achievement for Excellence in the Financial Reporting for fiscal year 2020. This is the highest form of recognition for government accounting and financial reporting, and the 5th straight year of Metro has received the award. I want to thank Dennis Anasike, our Chief Financial Officer, and his entire team for their hard work that has strengthened Metro's financial position and turned Metro into an example of strong financial management through government agencies. Now let me turn over to Tom and the entire team that's been working on this pandemic to give a more detailed update on our recovery plans.
Thank you, Mr. Wiedefeld, and good morning, Mr. Chairman and members of the board. Like previous updates, this will be a joint presentation. I will start and then turn it over to my colleagues to provide updates about Metro's workforce, customers, operations, finances, the capital program, and our next steps. Metro's recovery plan is designed to support the region's recovery and manage reentry, while protecting the safety and well-being of Metro's employees and customers, and staying ahead of demand as much as possible during the region's gradual recovery. Our recovery plan lays out a phased recovery of Metro service tied to external developments that we expect will bring more riders to the system. In August, we will cautiously transition from the stabilization phase of the plan to the managed reentry phase, extending Metrobus and Metro Rail hours and increasing the frequency of service while remaining focused on protecting the safety of our employees and customers. Metro is continuing to coordinate with federal, state, and local officials, as well as public health experts, and we're sharing information with transit agencies across the country and internationally. Jurisdictions in the region are moving forward with their phased reopening plans. These early recovery phases are incremental, and the jurisdictions are continuing to encourage, and in some cases require, residents and businesses to maintain social distancing, continue careful cleaning and disinfecting, and wearing face coverings. Many employers in the region continue to maximize telework, but we are beginning to see gradual increase in travel as some workers return. Each of the jurisdictions are carefully monitoring virus metrics in their communities and across the country as they cautiously advance their own managed reentry plans. And recently, several of the public school systems in the region have announced fall school restarting plans, most of them announcing that they will resume school in all virtual formats for at least the first half of the school year. I'll now turn it over to our Chief Safety Officer, Teresa Impastato, for updates on Metro's workforce. Thank you.
Thank you very much, Mr. Webster. To date, Metro has reported 210 confirmed cases of COVID-19. Of those cases, 186 individuals have returned to work. We've received over 1,000 COVID-19 related reports in our employee portal. These reports include confirmed cases, physician-directed quarantine, and other health concerns. With regard to infection trends, Metro experienced its first confirmed case of COVID-19 on March the 16th. Since that time, Metro has experienced a steady rate of infection of approximately 50 cases per infection incubation cycle or 2-week period. During the infection cycle from May the 15th to May the 29th, the number of new cases reported by Metro employees increased to 88. This increase aligns with the distribution of infection rates experienced in the regions at that time. The infection rate has subsequently reduced since mid-May to approximately 60 cases per cycle, and we continue to monitor current and projected case rates throughout the region for potential impact to our workforce. Metro wishes our employees, their families, and loved ones affected by COVID-19 a speedy recovery. As stated in earlier briefs, the Pandemic Task Force continues to focus our efforts on protecting employees and customers. First and foremost, we are reminding both our employees and customers to stay home if they are ill and to avoid using the system if they are unwell. As we progress through the phases of our recovery plan, we're continuing to maximize remote work of our office-based workforce as we establish new occupancy limits and deploy additional mitigations in facilities in preparation for a phased return to the office in the fall. We have enhanced our workforce management practices to limit maintenance crew sizes, employ staggered start times, and limit occupancy of shared spaces throughout the system. With our operations workforce, we are continuing to require social distancing for our employees and are encouraging our customers to practice social distancing. We are requiring face covering for both employees and customers and are working to further enhance our stringent cleaning and disinfection protocols. All Metro facilities and equipment are cleaned and disinfected in accordance with the Centers for Disease Control and Prevention guidance, using an EPA-approved disinfectant effective against SARS-CoV-2, the virus which causes COVID-19. This cleaning and disinfection occurs on a daily basis. Metro staff perform this cleaning and disinfection, which includes hand wiping of all common touch surfaces and the use of electrostatic fogging on bus and rail equipment. We also provide mobile on-demand cleaning of our station facilities. Metro utilizes expert cleaning services to provide third-party deep cleaning and disinfection in the event of a report of a presumptive case of COVID-19. This includes a report of a confirmed positive case or a report of an individual experiencing symptoms anywhere on the system. Responsive cleaning and disinfection has been performed a total of 516 times since March. To further augment the daily cleaning regime that Metro has established, recovery cleaning has been initiated to be performed by third-party experts. In alignment with the increase in service, recovery cleaning is being expanded in August to take place on a monthly basis throughout all Metro facilities. We are also exploring opportunities to perform rapid cleaning of our trains and buses throughout the service day. As Mr. Wiedefeld stated, Metro is expanding our ability to distribute facial coverings to our customers. And additionally, we are working to equip bus and rail facilities with access to hand sanitizer. With regard to our workforce protections, Metro has followed the hierarchy of controls to develop a comprehensive risk reduction strategy. We've worked with our labor organizations to design, develop, implement, and continuously evaluate this strategy. This includes our early actions to physically remove hazards as infection rates were increasing by closing stations, along with other targeted initiatives to eliminate exposure. With continued emphasis on remote work for our office-based workforce, we continue to avoid workplace exposure risk for our employees. In our recovery planning, we've focused much of our efforts on implementing mitigations that fall within the substitution, engineering, and administrative controls of the hierarchy. We've identified activities which we were able to transfer to third-party experts to both reduce the risk to our employees while enabling rapid and effective responses. With regard to engineering controls, we've increased our cleaning regime and made material modifications to workspaces to separate employees from customers and their colleagues. Administratively, we require facial coverings and social distancing of all employees and have implemented modified schedules and altered work practices to enhance the ability to social distance and avoid the risk of exposure. We continue to identify and evaluate new and emergent technologies and practices to further enhance the efficacy of our risk reduction program. Now, my colleague Lynn Bowersox, Senior Vice President of Customer Service, Communications and Marketing, will review our customer communication and outreach efforts.
Thank you, Teresa. In addition to our employees, it's very important that our customers understand our recovery plan. And to that end, the Know the Plan campaign is out in the market, driving customers to our website and raising awareness about Metro's recovery plan phases. The next wave of communications will reassure customers that we're doing our part, requiring facial coverings, cleaning and disinfecting frequently, and promoting social distancing where possible on the system. That campaign begins next month on news sites adjacent to COVID content, as well as in community interest sites such as El Tiempo and BET.com, on various radio stations through syndication, Pandora, Spotify, and then on local stations, WKYS, WHUR, and others, and throughout the bus and rail system on our own signage, of course. Our latest customer survey that we were using to inform our phases and service planning is in the field this week. And this shows you that much of what we've been seeing along in the pandemic has not really changed very much. 30 to 40% of rail and bus customers plan to use Metro when they're told to return to a workplace. And that is both according to our Smart Trip customer surveys as well as general population rider surveys. While I'll have more data on this soon, probably for the next board briefing in September, I do want to say that we are starting to see in our survey results and hear that childcare concerns paired with planned delayed school reopenings, in the sense that children will continue distance learning, are arising as factors in our customers' travel decisions. So while we have been doing a great deal of outreach through the business groups, through the business district members, through our own return to work portal on our website, We are learning that sharp ridership gains in the near term are highly unlikely from either the public sector or private sector because the return to workplace rates are still quite low. Examples of public agencies that are bringing employees back currently at a higher rate, which is perhaps above 40% of their population, include, for example, the Department of Defense, NIH, the Department of State, and many of them do offer free parking. And so we don't even see the benefit yet of return to work for a percentage of that workforce where free parking is also available. Private companies who are bringing employees back at a higher rate include, for example, law firms, Verizon, and companies like GlaxoSmithKline. Companies that are bringing employees back at a slower rate, for example, have been recently in the news. The Washington Post, for example, American University, George Washington University, Capital One, and Morgan Stanley. So it really does span the entire spectrum of the private sector. We have a couple hundred more employer inputs into our portal since even this data was prepared, and so we'll continue to sort through those, interpret what we're learning, and monitor that. Obviously, all of this information goes into our service planning efforts as we continue to figure out how to keep capacity ahead of demand, which is very important to our plan. I think this goes back to you, Tom, now.
Thank you, Lynn. In terms of planning service for our managed reentry phase, our goal is to ensure we run safe and reliable service. In order to achieve and to maintain that, we look hard at our workforce availability numbers throughout our crisis and sustainability phases, and we believe we can maintain an 80% workforce availability during managed reentry, meaning that 20% of the workforce is out sick, long-term sick, quarantine, or not available for other reasons. At this time, we have eliminated A and B days in maintenance in order to allow our maintenance crews 30 days to begin inspecting additional equipment, vehicles, and catch up on any deferred maintenance. And we will continue to communicate and remind our customers and employees to wear masks, practice social distancing, and continue to wash their hands frequently throughout the day. In terms of service during managed reentry, it is our goal to increase frequency, increase hours of service, and increase our extra board, which will allow us to cover absences or assist on heavy used corridors on the bus side. We believe our plan will make Metro reliable and meet anticipated customer demand. In terms of our bus managed reentry service plan, our service hours will be from 4 a.m. to midnight, and we will continue rear door boarding, collecting no fares. During the weekday, we will be running approximately 73% of pre-COVID service, with 52 lines operating normal, 64 lines operating on a reduced frequency, and 37 lines not operating during this phase. On Saturday, we will be operating 87% of pre-COVID service, with 53 lines operating normal, 30 lines operating on a reduced frequency, and 12 lines not operating during this phase. And finally, on Sunday, we'll be operating 86% of pre-COVID service, with 73 lines operating normal and 4 lines operating on a reduced frequency. In terms of rail service during managed reentry, we will return to peak and off-peak service. Our hours of service on weekdays will be 5 a.m. to 11 p.m., and on weekends, we will open on Saturday at 7 a.m., on Sunday at 8 a.m., and close both days at 11 p.m. In terms of frequency during the weekdays, we will run 8-minute headways during peak service on all lines except the red line, which will see 5-minute headways during peak service. During off-peak, we will run 15-minute headways on all lines except the red line, which will see a 12-minute headway. On weekends, on both Saturday and Sunday, we will run 15-minute headways on all lines except the red line, which will see 12-minute headways. In terms of overall service, this service plan is approximately 90% of pre-COVID service. It should also be noted during this phase, we will resume charging for parking and expand our after-hours ride-hailing program. And with this, I would like to turn the presentation over to Dennis Hennessy.
Thank you. All right, thank you. Good morning. As the board has seen over the past couple of months, ridership has been off significantly as a result of the pandemic. In May 2020, ridership was off by 89% compared to last year. As a result of the low ridership, as well as the rear burden and fare waiver Metrobus, passenger revenue was off $61 million on an operating basis in the month of May. However, WMATA also drew down $113 million of CARES Act funds in the month, which took total revenues to $119.2 million, which is actually $51 million higher than budget. As members of the board will remember, this initial CARES Act reimbursement was credited to regional bus operators based on the actions the board took in the prior month. With respect to operating expenses, WMATA remains under budget through the month of May, with expenses for the month at $2.4 million less than budget, again due to lower energy, materials, and supplies usage. Our preliminary estimate at this time is that WMATA will finish fiscal year 2020 with a balanced budget, again due to the early budget savings, as well as the CARES Act credit, when staff reports the final numbers for fiscal year 2020 to the board in September of this year. And as we begin fiscal year 2021, WMATA's financial outlook remains subject to the pandemic trends and impacts. If ridership rebounds are in line with WMATA's recovery plan, which is being discussed with the board, WMATA should be able to balance its budget in FY 2021, again with the help of available CARES Act funds. Otherwise, as the general manager mentioned a little bit earlier today, WMATA will have to take additional actions to reduce operating expenses unless there's additional federal funding. With that, I'll turn it over to Mr. Webster.
Thank you, Dennis. COVID-19 and our resulting response did have some initial impacts on capital project delivery. Pandemic has had direct impacts on supply chain and manufacturing, and Metro and our construction contractors implemented changes to work in the field consistent with CDC guidelines. Recognizing the opportunity to do additional maintenance and construction work during this period of lower ridership, we accelerated projects to include the platform reconstruction projects and track work. Overall, we anticipate that we invested over 95% of the $1.7 billion FY20 capital budget. Looking ahead to FY21, our current fiscal year, our capital program and budget focus remains on our priorities: safety, reliability, state of good repair, and projects that improve efficiency and reduce future operating costs and subsidy. We'll continue to accelerate priority projects while ridership remains low. And we plan to update the capital budget in the fall to adjust for project schedule changes. Now I'll turn it over to Laura Mason, our Executive Vice President of Capital Delivery, for updates on our summer track work.
Thank you, Tom. So in June and July, we completed 5 events on the yellow and green line, encompassing the first 6 weeks of these localized shutdowns. They were very successful, enabling the capital program to make up some of the delays we would have otherwise experienced due to COVID-19. On the Yellow Line Bridge, we were able to install new grout pads and replace nearly 900 rail fasteners. For our communications and cellular projects, we were able to install over 30,000 feet of radio and cellular cables and 3,000 feet of cabling infrastructure. Our fire and life safety projects also were able to make up a lot of time during these outages and replaced 3,500 feet of fire line standpipes, improving safety within the tunnels. We also installed 20 plus new standpipe connections and replaced electrical panels and transformers. Looking ahead for the remainder of July and through August, we have 3 more of these localized shutdowns planned. We have one ongoing right now between Judiciary Square and Rhode Island Station, which means the closed stations are Union and Noma. On July 26th and working through August 1st, we will close the red line between Fort Totten and Silver Spring, closing Tacoma Station. And our last event will be August 2nd to the 14th, a closure between Grosvenor and Friendship Heights stations, where the closed stations will be Medical Center and Bethesda. For these events, much like in June and early July, we will have bus bridges connecting the closed stations. With that, that is how we have maintained progress on our capital program. And so I will summarize the presentation on behalf of my colleagues with looking ahead at the 90-day schedule and where we think we will be in August, September, and October. In August, as you heard from my colleagues, on August 16th, we will start our rail managed reentry service plan, and the Silver Line and West Falls Church Station will reopen. On August 23rd, 1 week later, we will move bus into our managed reentry service plan. We anticipate seeing schools restarting at this time. We are preparing for the August 28th March on Washington as a potential significant event, as well as beginning our inauguration countdown planning meetings. And throughout August, we will ensure that employees have access to testing, helping them connect with jurisdictional resources. Looking ahead to September, on Labor Day, we will reopen Vienna, Dunloring, and East Falls Church stations, which means all stations that were closed for COVID will have been reopened. We will also begin a re-entry for our administrative employees and office staff. Those with a business critical need will resume working from our offices and reduce telework. We also continue our inauguration countdown meetings. Finally, in October, we will start our recovery service planning for delivery in early calendar year 2021 based on the trends we see at that time, and continue our inauguration planning events. With that, thank you very much for your time this morning, and we will take any questions you have.
Thank you, Ms. Mason, and thank you, Mr. Wiedefeld and your team. I'm going to go ahead and just go around the table if anyone has any questions or comments on the presentation. Ms. Gibbity?
Thank you. Good morning. My first question is actually around the communication campaign and the survey questions, the Rite Aid survey questions. Lynn, I was hoping you might be able to let me know if we've updated the questions. I think one of the feedbacks that we got was that a lot of our questions were really focused on larger employers. And for those who are retail or service workers, the questions didn't really fit their needs per se. And that because of the large employer focus, it was more so focusing on whether folks were going to telework and return back to work, skewing the information a little bit more. And so I wanted to see if you all were working on updating the survey questions, and if there were other ways that we might be able to collect real-time information. So for example, for those who are on my bus line, I literally have just been going down to the bus stop. Are we gonna offer the opportunity to actually meet folks where they are and trying to get more feedback? I think one of the things that the Rider Advisory Committee feedbacks was just, we are seeing an uptick, particularly on Metro Bus in terms of the use. And I'm excited to see that the service plans are adjusting to those pieces, but are there other ways that we're trying to collect real-time information?
Sure. So on the business front, a couple of things. We did in fact revise the question shortly after the last board meeting. And so we did that in a couple of ways. We changed some of the examples to be more about service industry businesses, and to try to limit the amount of references to telecommuting and broaden that out a bit in order to encourage more inclusive reporting. And I think that we've seen the benefit of that since the questions were refined. We are also obviously doing very real-time communication with many business groups, the DMV Task Force, the Greater Washington Partnership, Tyson's Partnership, Northern Virginia Chamber, there are so many, I can't name them all, but there's active, ongoing communications daily, weekly, monthly with those groups to try to make sure that all of the businesses are represented. As you know, Ms. Gideby, we've been doing calls with the business improvement districts, and you joined us for one of those calls where we got to hear from some very small businesses who are struggling with service workers getting to and from. And so we've been also able to work on a one-on-one basis, thanks to Mr. Nasike, in that instance for the downtown businesses that we talked to, expanding our overnight partnership with Lyft to make sure that people had subsidized available transportation during the hours when Metro's not operating. With respect to customers, we are broadening our research beyond focus groups and certainly doing what we can on the property. But I think what's most important is that we are being more aggressive in our sampling in order to get more and more input from bus customers. It is, in fact, one of the areas of focus for us is to get more on the ground grassroots feedback about what's helpful to folks.
Okay, that's really helpful. Thank you so much. And then my other question is focused on the service plan, specifically the bus service plan. And Joe, well, first, let me also just say thank you for the increase of subsidies for the ride share options. I think one of the feedbacks was that at this point we offer $3 subsidy. It's been doubled to $6. And while I recognize that that may not necessarily be enough for those who are doing a longer commute across the region, so from DC to VA or Maryland, I do think that it at least is a start and an additional help for those who are most in need and working after hours. So thank you. For the service plan, what I really wanted to focus on is actually something that I raised on the last meeting as well, which is the service guidelines. I believe we haven't updated our service guidelines for the bus system since the 90s. And I think as part of our transportation equity plan, we said that we were going to also have to update our Title VI plan as part of it. And one of the things that the service guidelines often does is offer a space for us in having metrics for how we're deciding the services that we're providing. And I just wanted to understand, even with this current reentry plan that you all have walked us through, are there criteria that we're currently using to make these decisions? I know in the past we were really basing it based off of A and B staff capacity, but in terms of reliability and the service needs for the regions, are those factors being considered? And is that something that you all may be able to offer us at the next board meeting in terms of just the updates?
You're absolutely right. Our guidelines have not been updated in many years. What we did when we looked at this managed reentry, we looked at corridors that had multiple routes. So for instance, if you had a local route and then you had a limited stop bus route that ran parallel, what we decided to do was eliminate that limited stop and make them all locals. So this way you would have more capacity stopping at all and hopefully keep down the social distancing. So that's what we really did when we looked at this managed reentry. So it's slightly different from our guidelines. We had to come up with real thinking out of the box, what to do in order to do that. But that's how we came up with the service that we're going to go with when we go into managed reentry.
Okay, that's super helpful. And Paul, is that something that maybe you all can offer us in terms of maybe in the coming upcoming board meetings? And the reason why I believe the guidelines are critical is because that's really what shapes, when we say reliability, it offers us some real criteria for us to base our information on. And oftentimes when we've done the budgets in the past, it's based off of the numbers, but not necessarily our promise of what we're saying we're going to offer from a Title VI perspective. And I just want to make sure that as we also in the fall have to look to budget season, that we're getting ready in advance for some of those pieces.
Yeah, I was going to add exactly. That will be the foundation of how we start to develop the fiscal year 22 budget.
Okay.
And it's going to take a lot of what we heard in the bus transformation study that talked a lot about what should be the criteria, how we determine where routes should be and the level of service. So that is, and I think it's a larger policy issue than what we're dealing with right now, which is how can we physically meet the demand out there now, given everything else that we're dealing with. But I think it's a larger policy issue for the board to work through this fall. But it is something that we will start to bring to the board starting in September.
Okay, perfect. And then my final question is around the ridership, 89% that Mr. Anasike had mentioned. And I also just want to offer my, it's been a big step for getting WMATA's books in order. And so to say that we've been awarded for 5 years is not a small feat. And I just want to acknowledge that overall. My specific question about the financial performance piece is it said that ridership was about 89%. And I just wanted to, are we talking about rail in terms of the ridership numbers? Just because we have been seeing higher numbers on bus. And so I feel like oftentimes when we're hearing these numbers, it sounds like it's the overall system. And I just wanted to make sure that I understood what that percentage was about.
No, this is Dennis. No, the 89% that I mentioned is the aggregate ridership, rail, bus, as well as metro access.
Okay.
That's the total for the month compared to the previous month.
Okay. All right. Thank you very much. No more questions from me, Mr. Chair.
Thank you, Ms. Gidby. Mr. Goldman.
Thank you, Mr. Chairman. I wanted to focus on some of the Metro bus numbers, but I first did want to clarify with Dennis Anasike the last point that he made regarding the 89%, the ridership was off 89% in May. So if it's an aggregate system that's off 89% in May, I assume the percentage off in Metro Rail is higher and the percentage off on Metro Bus is somewhat lower. Could you be more specific and specify what those rates are in terms of Metro Rail and Metro Bus before we move on?
Good morning, Mr. Goldman. Yes, as part of my response to Ms. Gidby, I should have added that with respect to Metro Rail, ridership was off by 95%. With respect to Metro Bus, it was off by 83%. And with respect to Metro Access, it was off by 75%.
Thank you. Are those, I thought the Metro, let me ask a question this way. I thought the Metro bus rates were a little better than what you just quoted, that in some of the prior months in May, that it wasn't in the 80s, it was more in the 70s. Is that correct, or has it been consistently off in that range of about 80-85%?
I think what we saw is that there's been some variability in the numbers, as we see historically. It was in the 70s a while back, but for the month of May, it was 83% off for Metro Bus.
Thank you. That clarifies that. I just wanted to shift now to Metro Bus, and you heard in the Riders Advisory Committee report a little earlier that the daily ridership on Metro Bus is now in the range of 120,000, 140,000, which is above what our standards were for the current period. In addition, during the interview of RAC appointees, at least I learned that there are some routes which were reported to be overcrowded and where people were actually standing during peak periods. And these are the Q, Y, and the Metro Bus routes on George Avenue. So I guess the question I wanted to ask, and I think it's a question to Joe Lederer, is are those observations valid? And if so, have they been already addressed? So we've reduced that overcrowding on certain Metro Bus routes, or is that something that has to await the August 23rd changeover to the managed recovery plan?
Starting today, we've added additional buses to 21 routes. Yes, some of the conditions that were mentioned do exist. I think what the challenge is it's not across the board. You may have a route that is heavy in the AM. You may have a route that's heavy in the midday or AM, midday, and PM. So what staff has been working on the last month is looking at where the peaks were. And what we've done today, starting today, is took our strategics. We actually assigned them as a route, a new run. And we have supervision that's out there. So there's 21 routes right now, or lines, I should say, that are getting additional buses starting today. And that will continue. And then August 23rd, we'll have, we'll be off A and B day on transportation. We'll be running much more service.
So there is a high probability that some of this overcrowding can be addressed now rather than having to wait till August 23rd. Is that what I hear you?
Yes.
Thank you. Finally, when we get to the managed recovery plan after August 23rd, what will that do for the 120,000 or 140,000 daily riders? Will that result in elimination of any overcrowding on bus routes, where some may be standing on bus routes, or are we still going to have pockets of bus routes where the bus capacity might be 75 or 80% with occasional standees?
Well, we should be doubling our service compared to what we're putting out there right now. So there should be more social distancing on a bus. We'll have to monitor once the 23rd comes in and then look at our extra board to see where we can now place. If we do see some crowding again in an AM or a PM or on a midday, we could start to add some additional buses. So we'll have to take a look at that right after August 23rd.
Yeah, I hope you will do that and give us a report in early September when we first meet, because I think to the extent that we're doubling that kind of Metrobus capacity, we should be able to address the kind of crowding that people are experiencing. And at least as we move forward through September, October, and November, that we kind of eliminate to the maximum extent possible that kind of overcrowding on certain Metrobus routes. So thank you, and I look forward to hearing your feedback on that in early September. Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Goldman. Mr. Horner?
I have no questions. Thank you.
Thank you, David. Mr. Letourneau?
Thank you, Mr. Chairman. So one of the things that we're hearing a lot of concern about is crowding, whether that's on buses or on rail platforms potentially down the road. And the concern isn't just coming from riders, it's coming from employers as well, who have employees potentially taking transit. Have we thought about, or is there any foreseeable way to try to A, manage that better, sort of from a social distancing standpoint, and B, use technology or at least communications tools to help disperse crowding when it occurs? For instance, if a particular metro platform becomes very crowded, can we proactively limit access to that platform until a train comes? And then, or potentially send an alert to riders saying, there's heavy crowding on X lines or whatever.
So, Mr. Letourneau, if I may address that. We spent a lot of time in focus groups with both our bus and rail customers discussing this very fact. And they are concerned about social distancing, but they do not want us to manage them physically. They want to see their fellow riders using good judgment, and everyone sort of positioning themselves on platforms, on trains and in buses where they can space apart. But they are very smart. They're longtime riders often that we're talking to who say, we know that it's not practical in a subway system or on a bus on a crowded route to always be able to socially distance, and then we have to make decisions about whether we're boarding that train or that bus or not, and that's our individual decision. Where we came out with them was on the need to have signage that encourages it. They want other passengers to be reminded of the importance of social distancing. they said, you know, the markers on the floors in the grocery stores, that's not going to work on our metro. We need signage that says, here's what 6 feet looks like, and this is what we encourage people to do. And that will be out with the next phase next month. We will have system-wide signage on bus and rail with creative messaging around social.
That's good, and I'm glad to hear that. Although I wasn't necessarily talking about us just physically, it was more from an information standpoint. Because what I have heard from people is you might be right in that they want to use their own judgment, but you don't know what's on a platform until you get down there. So you can't really use your own judgment if you don't know. So my question was more, you know, is there a way from a communication standpoint, if we do see significant crowding in a particular platform, to at least sort of give the rider some idea that that's what they're going to be walking into?
So I'll turn that back to Joe Leader. On a train by train basis, I think it's going to be difficult to do that. But overall, during peak periods, perhaps it's better handled on the outside of the train on the public address system by the operator. But I'll turn that back.
Yeah.
From the technology standpoint, there's a couple things that we can do to monitor. We have cameras throughout our entire system and on the rail side, so we can monitor platform crowding, and also, you know, since people are tapping in and tapping out, we can use that data in order and understand where we're seeing the peaks. We've identified even now, although ridership is way down, there is still a peak every morning and every PM, and that's why we built a schedule around it. And the way we built the schedule around it, we will have additional gap trains that will be manned and that we can put in service. But to get that information to a rider, I don't believe we'll be able to do that right now, but we will be able to monitor from a technology standpoint where we see crowding, and we can insert extra trains to clear the platforms as quickly as possible.
Okay, and my last question. So we're all kind of assuming this reentry based on demand, which I think is smart and what we have to do. But at the same time, kind of the national trends are sort of moving in the wrong direction. We just saw 3 big school systems in the region decide to do 100% distance learning. 2 of them that I'm aware of anyway, in Virginia specifically cited the increasing COVID numbers in the other parts of the state, and their belief that we're going to see some of that shifting back up and potentially seeing a relapse, which, you know, I think would certainly potentially bring us back into more restrictions and so on. So there's no way for us to necessarily predict that. But obviously, I'm sure that would have a significant impact on revenue in terms of operations. Once we sort of stand up increased service, how difficult would it be to stand it back down if that needed to happen?
Matt, this is Paul Wiedefeld. You know, as you know, this is a very large ship, so it isn't something that we can turn on a dime, but it is something that we are trying to constantly think ahead, and we will adjust. You know, if things start to pull back dramatically, then we would rethink what we're doing. But again, as you know, it takes us quite a bit to ramp up. I mean, right now, Joe's in the process of literally a month of going through all the systems, making sure it's ready to ramp up. So we will do that. So we want to remain flexible, but we have to recognize that these are very large issues. And then there's contractual issues that we have as well. But again, we're not etched in stone in any of this. We recognize that things change, and we've tried to remain very flexible within the construct that we have, and we'll continue to do that in the future, both in terms of what we learn with schools, what's going on with the virus itself, how the riders are reacting, how they're doing it, and then just things that occur, whether it's the march in August. You know, there are a number of things that can change very quickly on us. But again, our philosophy is, let's try to stay ahead of this as best we can, you know, give it the best that we can do, and put things in place, because it takes some time to put them in place. But then to get to Stephanie's point, but then also to try to react when we see things, you know, little areas here and there that we can adjust fairly quickly, get in and do those. And that's what Joe's trying to do, particularly on the bus side. Rail's a little different story.
Yeah, no, and I appreciate that. And part of the reason I asked the question was just so the public could hear that, because we get that. And I'm not sure it is entirely appreciated how difficult it is to turn the spigot on and off from a management standpoint. So thank you, all my questions.
Thank you, Mr. Letourneau. Mr. Meridian?
Thank you, Mr. Chairman. I don't have any further questions.
Thank you. Secretary Slater?
Good morning, Mr. Chairman. Thank you. Most of my question, I think, was answered in the line of questioning associated with the overcrowding, but just probably more of a question for taking a different angle on it, more of a question for the general manager and for Joe. Are we seeing, as the ridership is starting to recover slightly, are we seeing different travel patterns than pre-pandemic in terms of times of day and peaks and those types of things? And are we using that or not using that in what I would consider kind of our recovery planning, but also some of our kind of post-pandemic planning? Just trying to think about how travel patterns change with restrictions in people's daily lives and different work environments, and how much we're using that and how much we're not.
Yeah, I'll start and then Joe can get in a little bit further. But yes, we are monitoring that, on in effect a daily basis. The rail numbers obviously are a little bit tighter given the nature of how we tap in and tap out. So we can monitor, to the point, what's happening there. The bus is not. I mean, we have to be frank. Those numbers are not as strong because you're not tapping in. So it's very difficult to do that. But we're trying our best to get a sense of that. And we're also using, supervisors on the street. They see things. Station managers, they see things, and they're helping inform that. So there are some variations than maybe traditionally, obviously, with everything that's going on. And it's not, it changes. Just in a typical year, things would change month to month, week to week. So that plays out. But then just what's going on in the environment right now, where we're shifting from, people moving inside to do things to moving back outside, right? Just all those things are changing literally daily almost now, particularly over the last 3 months to a month. We've seen a lot more variation in some of the patterns. I think as people sort of make their own personal, as Lynn talked about earlier, they're making their own personal assessment, their own personal risk assessment on what they're doing, which then changes travel behavior. So we will continue to monitor that and do what we can where we can. But I don't see anything significant. Joe, I don't know if there's anything more that you can add on that you found in looking at the data.
So the only thing was really on the rail side, it surprised us. We thought a month ago we would just double service and flatline it across the entire system. But when we really looked at the data, we started to see that peak in the AM and peak in the PM, and realized as more of the workforce starts to come back, we would probably have to go to peak and off-peak service. That's the only surprise we really have.
Thank you. No further questions.
Thank you. And Mr. McMillan?
My items have been covered with other questions. Thank you.
All right. Thank you. Mr. Wiedefeld, we're not meeting in August. There's a lot, as Mr. Letourneau said, we're hearing from school systems. I suspect we'll be hearing updates from employers. What are you and your team going to be looking at over the next month as we head toward Labor Day?
Right. Well, the one thing obviously is where the district comes down with their school plan. I believe that right now that's scheduled for the end of this month, so that will give us better sense there. Part of the issue that we're also wrestling with internally is the impact on some of those decisions have on a workforce of 12,000 people. All right, so we have people that have childcare issues, schooling issues, and much less the health issues they're dealing with. So that is something that we have to constantly monitor, particularly as we start to ramp up. At the same time, we're trying to bring people back, anticipation of, trying to get back to some normalcy. At the same time, these other factors are impacting us. So that will be a lot of what we're focusing on. A lot of it will be on the internal. I mean, we've expressed today externally what we will be doing, but we have to internally keep managing this to keep our people safe and to deal with the realities of their what they're going through. So we will continue to do that. If anything significant changes, obviously we would go back to the board very quickly to alert you of that. And then also we're keeping a very close eye on some of the things that are happening, with different marches and different things of that sort, because that can impact us, very quickly. And really, those are the big. I don't anticipate anything changing on the sports arena or major events of that nature. It'll be interesting to see what plays out with some of the restaurants and bars, how that all plays out over the next month. As I think as the community as a whole is adjusting to that. So we will again adjust accordingly as where we can. And if not, we will start to revise our planning going forward, which we would present in more detail in September to the board if there's any significant changes.
Okay. And I think separately, we heard in some of the comments and questions from the board members and highlighted in your presentation, the financial side of the house, and maybe having to look at, a different process this year in terms of leading up to the budget and how that goes, maybe even starting as early as this fall, really.
Yes, on that point, thank you, Mr. Chairman, for raising that. Yes, we want to come back in September and start that discussion much earlier this year. And I think we have to start with the 21 budget. I think hopefully we'll have much more clarity on what's happening on the federal side with the CARES Act 2.0, if that occurs or doesn't occur, what's happening on the health side, what's happening in behavior side. So we'll have more real information. As you know, August is always an odd month in DC anyway, so that won't give us maybe as much as we want. But we want to come back in September and start to discuss both the 21, because we'll have more information on 21. We'll be almost 3 months into that budget, and we'll have a better handle on that and some of the things that we may or may not want to do as a board, as an agency. But then I think we got to start an early discussion on the 22 budget, because on the 22 budget, we want to deal with a lot of other complex issues that as we've talked about on some of the social and racial equity issues, obviously the funding issues, just the health issues that we're gonna have to deal with. All those, I think the sooner we start to work through those, the better, for our customers and clearly for the funding, partners that we rely on. So I think that starts sooner than later this year. So I plan to come to you in September with some significant sort of information to start that discussion. And then clearly we get into the true budgeting process later in the fall.
That's great to hear. And I know that, I've talked to some of the board members, and I know I personally think we may have to look at a slightly different process, maybe even having some work sessions targeted specifically on certain areas. Again, starting early, in September, October.
Very good.
Appreciate those comments. All right. Next, we will move on to my report. Over the last month, the Metro Board and staff have made strides toward advancing the transit equity in the region. First, in June, the board established the Metropolitan Transit Police Department Investigation Review Panel. I'd like to remind our audience, if interested in serving, to apply for the panel no later than July 31st. The application can be found on WMATA.com. Next, 2 weeks ago, the board and the general manager outlined a transit equity framework to advance policies and practices that support our mission. We have made commitments around policing, service, fares, contracting, training, and many other areas. We will be transparent and publicly accountable for these efforts. As we continue to look for ways to evaluate the conversation around these critical issues, we strive to not only follow best practice, but to also serve as an example and leader for others. Next, we will move on to the Riders Advisory Council appointments. Metro recently conducted a recruitment effort for 6 positions on the RAC and received nearly 80 applications. I want to thank everyone out there who applied. Now I'd like to move appointment of the following people to the RAC. And before I do that, I'd like to say how really impressed we were by the strong group of applicants and eventual nominees. We were particularly impressed by their answers on why they want to be on the RAC, their emphasis on governance of the committee, the importance of communication coming from and to the committee, the importance of transit to the region, and most importantly, the public or the rider and customer experience. So with that said, I will put a motion on the table to move the following appointments for the District of Columbia: Rob Kavese and Jamila McCoy. From Virginia, David Warmfeld. And for our at-large positions, Sid Divakarani from Maryland, Carolyn Baracco from Virginia, and Daryl Brewer from the district. Is there a second?
Second.
Seconded by Ms. Givity. Any comments or questions?
I just wanted to echo my appreciation to everyone who applied. I also just want to thank the board. When I think about where we were at the start of June as the unrest was happening, we were still trying to develop our response to the pandemic, the actions that we have taken to ensure that Metro works for all has been just swift, and I'm very and deeply appreciative. I also just want to offer my appreciation to the RAC leadership. They've taken on new chair and vice chair positions, which include Rob as vice chair for the district. I hope that we will continue to strengthen our relationship between the board and the Writers Advisory Committee over the next couple of months. It is critical to hear all of the voices and the outreach, and the number of people who have responded to this request, I think speaks to a willingness by the region and writers to want to ensure that we get their input. And so I'm excited about the new group of folks who are joining. And I also want to thank those who have served, including Catherine, who served as chair the last 2 years for the district. I appreciate your leadership and what you've done to date. And so I want to thank all those who have served in the past and for the new board members who are coming on. Welcome.
Thank you, Stephanie. Okay, if there are no other comments or questions, Ms. Ellison, do we have to do a roll call, or could we just do
Yes, I'll do a roll call.
Yep.
No problem. Chair Smedberg?
Aye.
Vice Chair Gideby?
Aye.
Vice Chair Goldman?
Aye.
Director Horner?
I abstain.
Director Letourneau?
Aye.
Alternate Director Meridian?
Aye.
Director Slater?
Aye.
And Director McMillan?
Aye.
The motion passes. Thank you.
Thank you, Ms. Ellison. And finally, as a reminder, the board takes a recess in August, so our next series of meetings will not be until September 10th. This concludes my report. Now I'll turn the floor over to Mr. Wiedefeld for his report.
I gave my report earlier, sir.
Okay, yeah, nothing to add after the
Yes,
COVID. Okay. All right, very good. Next, we'll move on to the following item from the Executive Committee. The following item was referred to the board at the July 9th Finance and Capital Committee, the Procurement Policy Manual Updates. Staff sought approval to increase the micro purchase and simplified acquisition thresholds and to allow for the purchase of commercial off-the-shelf items. The committee approved the proposed increase to micro purchase and simplified acquisition thresholds, but requested additional information regarding commercial off-the-shelf purchases. Staff has provided the information requested, and therefore I would like to move the following motion. And it's also my understanding that Mr. Goldman will be offering an amendment once the motion is on the floor. So I would move approval for the Chief Procurement Officer to establish maximum thresholds for micro purchases and simplified acquisition thresholds as outlined in the resolution. Can I get a second?
Second.
Seconded,
David Horner.
I heard Mr. Horner. Yep. Okay.
Okay.
Seconded by Mr. Horner. Now I'll turn it over to Mr. Goldman. Mr. Goldman.
Thank you, Mr. Chairman. Yes, you'll recall that at our July 9th meeting, there was some discussion of the commercial off-the-shelf issue with COTS, and that we decided to defer action on that. And so the resolution you're presenting has stricken the language on COTS. And so at this point, I would like to introduce an amendment to the resolution that would address the COTS issue. So I would move to amend the resolution approval of revisions to the Procurement Procedures Manual as follows. First, add a whereas clause after the fourth whereas clause to read as follows, and I quote, whereas direct purchase of commercial off-the-shelf (COTS) closed products that are ready-made and available for sale to the general public will enable WMATA to deliver efficient, timely, and cost-effective procurement of COTS products, unquote. And second, I would like to add a resolved clause between the first and second resolved clauses of the pending resolution that would read as follows, quote, resolved that the Chief Procurement Officer may establish procedures for the direct purchase of COTS products as that term is defined in 41 U.S. Code Section 104 in an amount not to exceed $50,000 per purchase order without requiring additional WMATA initiated competition, semicolon, and be it finally, unquote, picking up the rest of the pending resolution. So my expectation is that if this amendment is adopted, that the Chief Procurement Officer will adopt controls on COT spending within the $50,000 per purchase order limit, and that he will also quarterly provide reports to the board on the new COTS program. Thank you. That completes my amendment.
Thank you, Mr. Goldman. Is there a second for Mr. Goldman's amendment?
Second, Ms. Gideby.
Ms. Gideby. All right, we have a motion and a second on the amendment. Is there any discussion? Any questions? Okay. Hearing none, Ms. Ellison, would you administer the vote, please?
Okay, and this is the vote on the amendment. So Chair Smithberg?
Yep. Aye.
Vice Chair Gideby?
Aye.
Vice Chair Goldman?
Aye.
Director Horner?
Aye.
Director Letourneau?
Aye.
Alternate Director Meridian?
Aye.
Director Slater?
Aye.
And Director McMillan?
Aye.
Motion passes. Thank you.
Thank you, Ms. Ellison. Now, are there any further discussions on the main motion as amended? Ms. Gideby? Mr. Goldman?
No.
Are you asking for the vote or are you asking for comment?
No, just if you have any questions. Yeah, I think we should be good. All right. Anyone, no comments or questions? All right, Ms. Ellison, please administer the vote.
And this is for the main motion as
The main
amended.
motion.
Chair Smedberg?
Aye.
Vice Chair Gideby?
Aye.
Vice Chair Goldman?
Aye.
Director Horner?
Aye.
Director Letourneau?
Aye.
Alternate Director Meridian?
Aye.
Director Slater?
Aye.
And Director McMillan?
Aye.
Motion passes. Thank you.
Thank you, Ms. Ellison. Okay, this concludes my report. Next, we will move on to the report by the Finance and Capital Committee. I will now recognize Finance and Capital Committee Chair, Mr. McMillan, for his report. Steve?
Thank you. The following item was referred to the board at the July 9th Finance and Capital Committee meeting regarding the New Carrollton joint development approvals. Staff sought approval for 3 actions related to the proposed joint development at New Carrollton Metro Rail Station. Mr. Chairman, I'd like to move the following 3 actions. Approval of the compact public hearing staff report for changes to parking at New Carrollton Station. Execution of an amendment to the joint development agreement. And an increase in the FY 2021 capital budget and 6-year capital improvement program for the construction of a new parking garage. And for the benefit of those watching, this proposal was discussed in detail at the committee meeting 2 weeks ago. That's my motion, Mr. Chairman.
So there's a motion on the floor. Is there a second?
Second by Goldman.
By Mr. Goldman. Okay, we'll now open it up for any discussion. I'll go around the table. Ms. Gideby?
No comments at this time. Thank you. No comments at this time.
Yeah, no, I got that, Stephanie. I said Mr. Goldman. Sorry.
Oh, I'm sorry.
Yeah.
No, I would just say that this is an important project for Prince George's County and the state of Maryland and the entire WMATA system. And so I support it and I urge its adoption of the resolution by the full board.
Mr. Horner?
I have no questions. Thank you.
Mr. Letourneau?
No question.
Mr. Meridian?
No questions.
Secretary Slater?
No questions at this time. Thank you.
Thank you. And Mr. McMillan, any final comments?
Nope.
All right. Ms. Ellison, please administer the vote.
Chair Smedberg?
Aye.
Vice Chair Gideby?
Aye.
Vice Chair Goldman?
Aye.
Director Horner?
Aye.
Director Letourneau?
Aye.
Alternate Director Meridian?
Aye.
Director Slater?
Aye.
And Director McMillan?
Aye.
Motion passes. Thank you.
Thank you. Next,
Mr. Chairman, that concludes my report.
Thank you, Mr. McMillan. Appreciate that. Next, we will move on to 2 consent items on today's agenda. I would like to move the following. First, the Fairfax County Free Student Bus Pass Program Extension. Staff seeks board authorization to exercise the current year extension and remaining options to continue the fare buy-down agreement with Fairfax County for the Fairfax County Free Student Ride Bus Program. And C, the Montgomery County Free Ride Program Indemnification. Staff seeks board approval to include a mutual indemnity clause as required in the fare buy-down agreement for Fairfax County Kids Ride Free and Senior Ride Free programs. Can I get a second?
Second, Mr. Chairman.
Thank you, Mr. Goldman. Seconded by Mr. Goldman. Any comments or questions? If none, Ms. Ellison, please administer the vote.
Chair Smedberg,
Aye.
Vice Chair Gideby,
Aye.
Vice Chair Goldman,
Aye.
Director Horner,
Aye.
Director Horner, thank you. Director Letourneau,
Aye.
Alternate Director Meridian,
Aye.
Director Slater,
Aye.
and Director McMillan.
Aye.
Motion passes. Thank you.
Thank you, Ms. Ellison. So these items are approved. Next, we will move on to the reports by the jurisdictions, NBTC. I do not have any report. Mr. Letourneau, anything you'd like to add?
No, maybe just that MVTC has been engaging in an exercise to look at the 3% cap as mandated by the Virginia legislature. Both the cap is mandated and, in fact, the legislature actually mandated that MVTC do a study on the 3% cap. And so that process is concluding. There have been interviews with us, with the general manager, with a variety of stakeholders. I think the conclusion is likely that MVTC itself will not seek changes to that cap at this point, but we'll wait for the final adjudication of that.
Thank you. From the district, Ms. Gideby? Any report?
I don't have an official report, but I believe Director Marushian has some announcements on the dedicated bus lanes.
Mr. Meridian?
Thank you. I just wanted to provide a brief update since this was announced in the time between this board meeting and our previous board meeting, that Mayor Bowser announced just a few weeks ago that the district will be adding some dedicated car-free transit lanes across the city. And as many know, we've got one construction project on 14th Street Northwest that's underway. And just last week, DDOT issued the construction solicitation for the 16th Street, the long-awaited 16th Street Northwest dedicated bus lanes. And in just a couple of weeks, we'll also be starting work on 3 new dedicated transit operating facilities. And one of them is 7th Street Northwest in Chinatown, Martin Luther King Jr. Avenue in Southeast Washington, and then M Street in Southeast and Southwest Washington. So we are taking very seriously our role in implementing the study recommendations from the bus transformation study and doing everything that we can as a city to support WMATA's operations across the district and across the region.
Thank you, Mr. Meridian. Appreciate that update. Mr. Goldman, WSTC.
I have nothing for WSTC to report, but I yield to Secretary Slater if he has anything to report on a statewide Maryland basis.
Secretary Slater.
Thank you, Mr. Goldman. Thank you, Mr. Chair. Just, we as a region continue to recover and really have to continue to be vigilant and do what's in the best interest of our citizens, and we will continue to do that. So thank you.
Thank you. And finally, from the federal government, Mr. Horner.
There's no report. Thank you.
Thank you, Mr. Horner. With no further business to come before the board, we stand adjourned, and I will move to executive session. In accordance with the bylaws, I, Paul Smedberg, request that the Board of Directors convene an executive session to discuss the following matters pursuant to Article 2, Paragraph 9, subsections A, budgetary matters that may affect legal positions, WMATA contracts, or sensitive relationships with local jurisdictions or the federal government, and C, personnel or labor issues, including discussions of labor contracts and labor negotiations, consideration or interviews of candidates for employment, and the assignment appointment, promotion, performance, demotion, or resignation of individuals. And D, contractual or other matters, including confidential or proprietary concerns, or the investment of public funds where discussion in public would affect the financial interest of WMATA. And F, safety and security matters, where premature release would compromise public safety. Is there a second?
Second.
Seconded by Mr. Horner. All those in favor?
Aye.
Any opposed? The ayes have it. Thank you very much. We will take just a few-minute break as we transition over to the executive committee room. Thank you very much.
Thank you.
Thank you for joining us this morning, everyone.